Hello, today we're going to use a Suresult D3 Ultra handheld ultrasound to investigate the thyroid gland looking for nodules. Nodules are very common. Most people have nodules. They're normally benign, but what if they're not benign? So we're actually going to do this on myself. Typically I use my wife as the sample patient for these videos, but her thyroid is boring. It's normal. I have a thyroid nodule. So not only are we going to scan and find it, and we're going to take measurements, but we're going to see, should I worry about this? And do I need an aspiration or not? And I'll cover the sort of requirements and the guidelines as to what to do when you're looking for nodules and whether follow-ups are necessary and whether aspiration is necessary. In terms of patient positioning, typically the patient is supine on an examination bed or table, and the sonographer or the doctor is standing sort of next to them or sitting next to them. But there's a little bit of a problem with that position. It's fine, you have good access to the thyroid gland, but you have to be careful with your arm. I've heard of complaints, particularly from female patients, that the sonographer or the doctor molested them. You can imagine if you're here, where does your arm rest? The doctor's arm is going to rest on the breast. So be very careful with your positioning. I like actually sitting position. So I'll place the patient in a chair and I'll stand behind them. I can have the screen in front of both the patient and myself, so we're both looking at the screen together. And that's a very comfortable position to scan from. The other position that works very well is patient face up, so supine again. This works well with a chiropractic table where there's space at the top of the table, so I sit behind them, and it's very similar to the seated position. And again, there's no way I can accidentally brush up against someone's breast from that position. Now, the thyroid is a relatively shallow structure, so we're going to be using the linear side of the transducer. You want to use a relatively high frequency, something in between maybe 10 to 15 megahertz for checking out the thyroid. If you haven't evaluated the thyroid before, a lot of people think it's higher than it is because the thyroid cartilage is way up here, but the thyroid gland is much, much lower. So just keep that in mind. And let's talk protocols and documentation just for a moment. Now, as a point of care practitioner, I often have a clinical question in mind, and I'm just scanning to answer that clinical question. These series of videos I have one question, I'm going to scan it just enough so that I can answer that one clinical question. Sonographers, particularly the technicians, they might just be taking pictures to send to a radiologist who will then evaluate the pictures. So they have a list of pictures that they need to take. Whereas for myself, particularly if it's normal, I might just take a couple images just to prove that I did scan it, but I'm not necessarily following a protocol. I don't have a set number of pictures I need to take. And on different days and for different people, I take different pictures because I might have different clinical questions. The typical protocol for a sonographer is they might come in sagittal, measure the dimensions, lengthwise, and take a picture. They go in a transverse plane. Again, they measure the dimensions and take a picture superior, take a picture inferior, screen through, done. But for us, particularly for this video, I don't care about the dimensions of the thyroid. I am looking for nodules. If I find a nodule, then I'm going to take measurements of that nodule. I don't really care about the overall size of the thyroid because that isn't my clinical question today. And a general rule of thumb is to screen through structures in two planes. Basically, you could screen through in this direction and screen through in this direction. And then if anything looks wrong, if I see a nodule, that's where I go on both planes and I take measurements, and I take measurements of the nodule. And we need those measurements of the nodule to determine whether we need follow-up, whether this might be malignant or not. Okay, so let's scan my thyroid. As I mentioned, I should have a nodule somewhere, so let's find it and evaluate it. So I just need some gel on the unit here. Plenty, and let's see what we see. Okay. But there's a few things to talk about already. So what are we looking at? So this here is our thyroid gland, and that is an artery. Now, to identify the vessels, well, a nodule is going to appear and disappear as you screen through it because it's small, or it's round or oblong. It has a finite size. Blood vessels will continue. You can follow it up, 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 and you can follow it down, down, down. The other thing you can do is you can turn on color Doppler or power Doppler, and of course the blood vessels are going to pulse because they have fluid in them, whereas you don't expect that pulsatile flow through the entire nodule. So that's another way to sort of distinguish a blood vessel from a nodule. The other thing you'll notice is the sort of edge effects here, sometimes called refraction artifacts here with the blood vessel. We also have a bit of a shadowing artifact here. So my thyroid gland, it doesn't actually have a shadowed section within it. This isn't a cleft. It isn't cut in two. What's happened is that because of all this fascial tissue right here, this is preventing some of the sound beams coming this way from going into this region. So less sound beams from this area are reaching back to the transducer, and so the area appears darker than it should be. So this is an imaging artifact. So this is just an imaging artifact. This is nice and uniform thyroid tissue. This is normal thyroid tissue. Now, if you want, you can turn on, I have just normal beam mode on. So you can even try compound imaging if you don't like sort of this speckled appearance. It'll smooth things out, but at the cost of some frame rate. And there's different types of compound imaging. I believe this is frequency compounding instead of spatial. Spatial compounding imaging can sometimes prevent some of that fascial shadowing artifact from appearing. So this is compound imaging on, and I can turn it back off. I prefer it off unless I'm taking a really nice looking picture. If I want a nice looking picture, I'll turn compound imaging on because sometimes it gives you better looking pictures. So let's find that nodule. So I can screen all the way up to the top, and I can follow it down. Gonna get a little bit of that artifact. Oh, what the heck is that? A dark circle appears and winks in and out of existence. That's not normal. Let's finish screening. Screen all the way down, all the way down, all the way down. And there's nothing else funny going on. Just that one tiny nodule. Okay, so let's go to that nodule. Okay. So it's sometimes difficult to get that perfect picture, but remember you can record cineclips. With the software here, I can just swipe left and right, and I can go through the individual frames. So I can try to find the best frame for taking measurements. Right? And we want all the largest measurements. So maybe there would give us the best measurements. So I can at least get 2 measurements here, some lengths. And a lot of the guidelines, you want sort of the largest measurement. So 4 millimeters there. I can get another length here. And also 4 millimeters. So it's 4 millimeters by 4 millimeters so far. And we have to, of course, go in the other axis and see what it is in that axis. So I can save this image. And then I'm going to go in the other axis. Here we go. And you can screen through in this axis, see if there's anything strange. And right away, you can see where that nodule is. Maybe that's the best picture of it there. Let's take a measurement of that. So it's about 5. So it's 4 by 4 by 5. So not that big. So do I have cancer? Is my thyroid nodule an issue? If you remember the dimensions, it was 4 by 4 by 5 in terms of millimeters. So less than 1 centimeter large. You'll learn if it's less than 1 centimeter large, it's probably not malignant. But there are guidelines, for example, from the American College of Radiology. They have the TRADS chart, and you basically give points for the composition, the echogenicity, the shape, the margin, whether there's echogenic foci, and you basically give points, and depending on how many points, whether you need to follow up and monitor, because it's a little suspicious, moderately suspicious, highly suspicious, whether you need an aspiration or not. Again, whether you need an aspiration, it's how suspicious is it and how big is it. So let's quickly use my nodule as an example. Composition. Cystic or almost completely cystic, spongiform, so it looks like a sponge. And both those are 0 points. So even if you have a nodule and it's spongiform, that can be perfectly normal, probably benign. In fact, there's a special condition here that if it's spongiform, if it looks like a sponge, don't even bother calculating other points for other categories. It's benign. So mixed cystic and solid and almost completely solid. Mine was cystic, so 0 points. Echogenicity, mine was black. Mine was anechoic, 0 points. Shape, wider than tall or taller than wide. Now what they mean by tall is the anterior to posterior distance. And mine was 4 millimeters. The 5 millimeter measurement was superior to inferior. So mine is wider than tall. So it's not tall. The tall isn't the largest dimension. So 0 points. So far I'm 0, 0, 0. Margin. Now it's in one plane it looks smooth. In the other plane it has a little bit of irregularity to it. Just a little bit. Maybe it's ill-defined. So maybe I would call this ill-defined at worst, 0 points. So far I'm 0, 0, 0. Echogenic foci, are there microcalcifications, peripheral calcifications, comet tail artifacts? We didn't see any of this stuff, so 0 points. So 0 points, benign. Don't worry about it. And if you want this chart or a chart like this, there's many charts like this online. And of course, you can look up the original paper from the American College of Radiology. Or for example, you can, like, here's a calculator, you just put it in and it tells you. It also summarizes some of the information for you from the research paper that created the TRADS classification, like how many points and what's the risk of malignancy. Now, in terms of follow-ups, if it is getting worse, I know it says follow-up at 1, 3, 5 years. If you follow up at 1 year and it jumped from a TRAD score of 3 to 4, don't wait 2 years to follow up again. If it's getting worse, follow up at least once a year if it seems to be getting worse. I've actually seen a very large nodule, almost 3 centimeters I think in size, and I followed up a year later and it was gone. I couldn't believe it. She couldn't believe it. She's like, "You're making a mistake." It's like, no, it's not there. I trust myself. So these things can get worse and they can actually get better. But it's just as easy as that. The thyroid is one of the easiest things to check. And just following the TRADS chart is super easy. And I think if you have any suspicions and you have an ultrasound unit, why not check it out? I'll add that if you're interested in one of Suresult's ultrasounds, Suresult wanted me to say that they put a lot of effort into making sure that their units meet international certifications, and they also put a lot of effort into handling duties and importation issues. So a lot of people are concerned about that, so they wanted me to share that. Anyway, cheers!